Well, good morning, podcast listeners. This is Ron Lanton. Hope you're doing well today. And on our show today, we have a really special guest, Jackie Gagnon, Director of Medication and Use Policy and Informatics at Mass General Hospital. How you doing?
I'm good, Ron. How are you?
I'm doing real good for Friday. And wanted to talk to you about MSHP and legislative agenda for 2023 that's coming up on us. So before we get started, can you tell our listeners a little bit about who MSHP actually is and what do you guys do?
Yeah, sure. So MSHP, or the Massachusetts Society of Health System Pharmacists, was founded, well over 75 years ago. And it really is a group that focuses on representing the pharmacy workforce in Massachusetts in hospital and health system pharmacy. So these are your pharmacists, your pharmacy technicians, your interns that are working in hospitals and also in healthcare systems in other roles. So could be in the clinic, in the infusion center, in some cases, even outpatient pharmacies within our healthcare systems. So we have about well over 4,000 members in the Commonwealth in Massachusetts and over 40 institutions represented within our membership. We're an affiliate of ASHP, the American Society of Health System Pharmacists. So, we work with them often on federal issues and more national issues.
And I know I've talked to you before about the concept of hospital pharmacist.
Mm-hmm.
And how that was like really different. Like, you picture like a pharmacist and like a CVS or something like that, but how you guys are different because you have different roles. Like, how does that work exactly?
Yeah. And I think a lot of times, it may not be the first thing that comes to your mind when you think about pharmacy. I think a lot of times you don't picture that pharmacist that might be when you're in the hospital and, you're admitted. And then on the inpatient side, there's, pharmacists and pharmacy staff working behind the scenes sometimes, getting medications prepared, getting medications to you, or maybe even working directly with you, talking to you about your medications, working with the medical team. But it might not be the first thing that sort of comes to mind.
Yeah. So what's your role there?
So at MSHP, I'm chair of the legislative committee. So that is a group, I sort of started to get involved with that group because I was a delegate for Massachusetts. So, through Massachusetts, we have 4 delegates within MSHP that represent, Massachusetts and their stance on policy issues and vote at the national level. And so that helped me to start to get involved a little bit more working with the society on legislative issues at the state level, and started working with the legislative committee, which is a newer committee in the past 2 or so years to MSHP. And so I'm the chair, and so I work closely with, a really good group of members that are interested in being involved with advocacy at the state level.
Have you done advocacy there before, like on your own or anything like that? Or is this like the first time?
So I'd say this is more of the first time that I've really, I think, gotten involved at this level, beyond just sending a letter in support of a bill or a stance on an issue. I think this is the first time I've really gotten involved where I've been working closely with members to think about what we want to focus on, what bills we want to make sure that we're monitoring and, trying to help coordinate support for it amongst our membership. So definitely at a different level than anything before.
So with the new year, literally like in like 2 days, 2023 is coming, obviously. So what is MSHP's plans for 2023?
So I think in 2023, our biggest, our highest priority is we really want to introduce legislation that supports provider status for pharmacists in Massachusetts. I think that's really been an area of focus, certainly of opportunity to help to define a little bit more what that means. And so what we're really looking to do is hopefully introduce some legislation that will support a pharmacist's role in test and treatment of a variety of disease states that we've already kind of shown, I think, and demonstrated, especially throughout the pandemic, that we're able to help support and care for patients by being involved with their testing and treatment. So very similar to what a lot of other states have done throughout the country, trying to enter some legislation very similar to that.
That sounds good. Yeah. I mean, with the pandemic, it's really taught a lot of people that have heard about pharmacists being an important part of the healthcare system. And now people have really understood that, I think, especially with the Paxlovid prescribing for
Mhm.
pharmacists. I think that's something that's really good. So
Mhm.
what you described sounds like it's definitely needed.
Mhm.
So I know we've come to the end here, and I know I want to have you guys back on so we can take a look at how the year is progressing. I know that Massachusetts is getting ready to get a new administration.
Mhm.
So I want to see if your plans have changed a little bit later in the year. How do our listeners get a hold of you if they have questions about maybe how to work with MSHP legislatively, or they have questions about hospital pharmacists, or maybe it's a policymaker, on Beacon Hill that has a question about just healthcare in general?
Mhm. So I think anybody that wants to get in touch with us can email us at legislative@mashp.org. So that's legislative@mashp.org. And that will get you right to a couple of different folks working at MSHP, as well as the legislative committee.
Sounds good. Well, make sure you definitely reach out. These guys are in it to make good policy. And we're going to have you back on, Jackie, to give us an update and see how things are going in 23.
Thanks so much, Ron.
You're welcome.